Now for the next pathology which we'll be looking at, we'll look at the pathology of tuberculous meningitis. Pathology of tuberculous meningitis. Now, pathology of tuberculous meningitis is quite literal. You just have to say, yes, there's inflammation of the meninges. Now, there's inflammation of the meninges, and this is caused by what? The presence of what? Tuberculosis. Okay, the tuberculosis. Okay, so it's just a severe form of what? Extrapulmonary tuberculosis. So when we say extrapulmonary, tuberculosis primarily what? Affect the lungs. So if it's going out of the lungs to affect any part of the body, you call it extra tuberculosis. So it's outside, the primary region, So this is caused by Mycobacterium tuberculosis invading the central nervous system. So it typically results from what? There's a spread through blood. So there's a spread through blood, and this spread is a spread that is actually reaching the brain. So key pathological features, that's like if you observe it on a microscope slide, you see that there's rich foci formation, so small subpial or subependymal granulomatous lesions called rich foci. They develop during early dissemination. Rich foci may rupture into the Subarachnoid space. This triggers meningitis. Okay, that's what triggers the inflammation of the meninges. The leptomeningeal inflammation, dense granulomatous exudates, accumulate in the base of the brain. Can you say it? Okay. It's composed of lymphocytes, macrophages, of course, epithelial cells, Langerhans cells. Now, the immune cells are actually coming here because they want to actually fight the inflammation, the infection. Okay. So it causes what? Caseous necrosis. Okay, often present. So vascular involvement, there's inflammation of blood vessels, could lead to thrombosis, infarction, or stroke-like issues. Then hydrocephalus, there could be blockage in the drainage of the cerebrospinal fluid, leading to accumulation. Then tuberculomas, that's one you are basically having all those tumor growths, okay, because of the tuberculosis. Okay, so that's it for this tuberculomas. So microscopic findings, granulomas which was central caseation, surrounding lymphocytic infiltrates, and multinucleated giant cells. In chronic cases, you are having dead tissues. So there's fibrosis, calcification can also be seen. So clinical correlation, symptoms often develop subacutely. So you are having headaches, fever, vomiting, altered mental status. Then neurological issues like cranial nerve issues, then seizures can also develop. Okay, so that's it for tuberculous meningitis.